Ngwatanio ya atetheesya matakitali kana Kenya National Union of Nurses kauntini ya Masaku niyatisya kana kwa kilungu cha mithenya 21 yukite nimeitha maitwaaisya mukomo kwa kuungamya vyu maundu ma uiiti kwa ethiwa silikali ya kaunti ya Masaku ndithinikia mathina ala maendee na umekaliila kwivo kwemna kwambatw'a ndeve na kuthukumia mawithyululukoni mailu na kwitha vatena athukumi eanu muveani usu wa uiiti silikali ya kaunti ya Masaku. Mwavuasu maumbulwani mwandiki wa ngwatanio ya manasi kuma kauntini ya Masaku na ulani Michael Saka ula waelesya kwa kana ona itina wa kwithiwa mavikiti kiyocho maofisini mekivathukanio ma silikali ya kaunti ya Masaku methitu mate kwithukiwa na kusesengwa na ndeto sya uvongoli na musangi yetu elesya mwavuasu mbenge.
Mapambano. Ngwatanio ya manasi kauntini ya Masaku kwisila mwene kivila wa Mike Saka ni ambula maitwaaisya mukomo itina wa mithenya 21 ethiwa mathina moma itho mathinikie kwivo kwitha masivitali kauntini ii matena miela ya ilite ya kutumika ni matakitali na manasi kuita wau masivitali ama kaunti ya Masaku kwitha matena maofisa maanu ma uiiti na kia kumakia mono sivitali munene wa Masaku level 5 kwitha utena liwa wau kati wa maundu angi.
And the major goal is our patients who happen to be your electrolytes. So number one, give us enough staff in the hospital. A letter kindly, correctly and addressed to Her Excellency the Governor. We have addressed the letter to the Chairman Public Service Board. We have addressed the letter to the County Secretary, the Head of Public Service. We have addressed the letter to our CEC, Dr. Yumbia. Give us enough staff. You interviewed people. Why haven't they ever been deployed? Secondly, we are in the issue of staff, still in the issue of of staff. We're having UHC staff who have been on contract for more than 3 years. Those are clearly unfair labor practices. Let's desist from doing that. Secondly, provide us with adequate hospital supplies. Tumechoka. Tumefanya nini? Tumechoka. Provide us with adequate hospital supplies. Those supplies are being used to treat your constituents. Number 2, promote, redesignate, and pay our arrears. Hiyo ni haki ya nani? Hiyo ni haki yetu. Number 4, as workers in this country, we're entitled to a CBA. We want our CBA signed, registered in court, and implemented. We're having a problem with supplies in the hospital. Right now at level 5, we don't even have food for the patients. Our patients are being brought food daily. Imekuwa kiosk. We are wondering what is really happening. The other day we had issues with our support staff. They are not being paid appropriately. What is really happening in health?
Kitumiki ngwatanio ya manasi kauntini ya Masaku ni amanyithia kuita nene nzima kaunti ya Masaku na makaunti lithangianie na kaunti ala moka kumanza uiiti sivitalini sya kaunti ya Masaku kana maiketha matonya kukwata uiiti masivitalini ma kaunti kuma matuku 24 mamwe ethe mathina moma itha mathinikia ni serikali ya kaunti
Today we've issued a 21-day strike notice. Be rest assured, we will close down all facilities in this county, from level 5 to level 2. Not only will we be closing down the health facilities, we have other people who have so many grievances against pertaining to health who will be supporting us. And I can assure you, health will come and ground down on 24th of July this month. Yet you are saying health is working. Health is not working in Machakos. It will only work when you look at health at the human resource aspect, especially health workers, which is one of the pillars, one of the major pillars of healthcare delivery in this country.
Good report, Evelyn Musangi.